It is April 3rd, 7 p.m. Hi, my name is Brady. I'll be doing your head-to-toe assessment today. We will begin your head-to-toe assessment by looking at the head, face, neck, anterior and posterior chest, abdomen, and upper and lower extremities for color, temperature, moisture, texture, edema, turgor, bruising, scarring, lesions, and nevi. No obvious abnormalities noticed so far, so we'll begin with our assessment of the scalp and hair. Hair is distributed evenly, nice brown color, soft texture, no lesions, masses, depressions, infestations, or tenderness noted to the scalp. So now we will move on to assessing our temporal arteries. Temporal arteries are equal bilaterally. And now we're going to start assessing our lymph nodes, our preauricular, postauricular, occipital, our tonsillar, submandibular, and our submental lymph nodes. Now we'll do our anterior cervical lymph nodes, posterior cervical lymph nodes, and our supraclavicular. No lymphedema or tenderness noted on palpation. Now we're going to start looking at the eyes. The brows are equally distributed. They go beyond the length of the eye itself. Lashes curl up and away from the eye. Now to assess cranial nerve number 2, the optic nerve, we'll begin with a visual acuity test using a Snellen chart. Yes, cover one eye and read the lowest.
P-E-Z-O-L-C-F-T-D. P-E-Z-O-L-C-F-T-D.
All right. Patient's visual acuity is 20/25 bilaterally. Now for cranial nerve number 3, the oculomotor, or actually to finish cranial nerve number 2, we'll also check peripheral vision. I want you to let me know when you can see my hands.
Now.
Perfect. Now for cranial nerve number 3, the oculomotor, I'm going to use my pen light. I want you to look up here at me. Great. Now I want you to look here at my finger, look up at me, and then back at my finger. Great. Now I want you to follow this finger. Great. Great. Keep going. Perfect. Eye movement is smooth bilaterally, and pupils are equal, round, reactive to light with accommodation and convergence. Now we're going to move on to our ears. I'll start by looking at their size and position. Size is equal, position is equal also bilaterally with no obvious abnormalities on inspection. Palpation of the pinnae and the tragus for tenderness and masses, none found. So now I'll begin looking at our tympanic membranes. The tympanic membrane is pearly and gray. And pearly and gray. Now we're going to perform some hearing tests. So our first one is going to be called the whisper test. I want you to cover your right ear. I'm going to whisper and repeat after me.
Love.
Other side.
You.
Great. Now we're going to do what's called the Weber test. I'm going to hit this tuning fork. I want you to let me know if the sound is equal on both sides.
Equal.
Perfect. Now for the Rhine test, I'm going to strike it. Let me know when you stop feeling.
No.
Perfect. Let me know when you stop hearing.
No.
Great. Now for the other side, stop feeling.
No.
Let me know when you stop hearing.
No.
Great job. Air conduction is greater than bone conduction. So now we're going to move on to the nose. The nose is symmetrical. It's midline in the face. To check for patency, I want you to cover one nostril. Great. Great. Now we're going to check cranial nerve number 8, the olfactory nerve. I want you to let me know what it is that you smell.
Alcohol.
Great. Now we'll move on to the mouth. I'm going to begin looking at the lips, the teeth, the gums, the buccal mucosa, the mucous membranes. All the membranes are pink and moist. Palate is intact and hard. Now lift your tongue for me. Lower palate is also intact and equal bilaterally. Now, I want you to say ah.
Ah.
Great. Now I'm going to check your gag reflex. Perfect. Now I want you to stick your tongue out. No fasciculations noted. Now hold it back in. No fasciculations noted inside the mouth either. That concludes assessing cranial nerve 6, the abducens nerve. So now we're going to move on to our neck and throat. Our tragus is midline. Now our thyroid gland, I want you to swallow for me. Perfect. Thyroid is midline, equal bilaterally. Now we're going to move on to our posterior chest. We're going to check chest wall expansion. Chest expands equal bilaterally. Now let's check tactile fremitus. I want you to say 99.
99.
Perfect.
99. 99. 99.
Tactile fremitus equal bilaterally. Now we will auscultate our lung fields. Great. Now I want you to say E when you feel my stethoscope.
E. 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 E.
No egophony noted. Now to check bronchophony, I want you to say 99 when you feel it.
99. 99. 99. 99. 99. 99. 99. 99.
Great. No bronchophony noted either. Now for whisper pectoriloquy, I want you to whisper 1, 2, 3. No abnormalities on the sounds heard for those 3 exams either. Now, to continue the posterior chest, I'm going to have you lean forward and I'm going to percuss the lung fields. Tympanic throughout. Now moving on to the anterior chest, we'll repeat chest expansion and tactile fremitus, say 99.
99. 99. 99. 99. 99.
Great. Now I'm going to auscultate the lung fields of the anterior chest. Great. No adventitious lung sounds heard on the anterior or posterior chest. Now, also no signs of respiratory distress noted, no cyanosis, no use of accessory muscles, and no retractions. Now we're going to begin our heart exam. To start, I will auscultate at the second intercostal space on the right mid-sternal border to assess our aortic. Second intercostal space, mid-sternal border for our pulmonic. Erb's point is at third intercostal space in mid-sternal border. Then fourth intercostal space, mid-sternal border for our tricuspid. mitral, fifth intercostal space, midclavicular line. I'll stay here and auscultate for a full minute to get the apical pulse, rate, and rhythm. Rate is 76, rhythm is regular, S1, S2, with no murmurs or extra cardiac sounds heard on any of the points. Now I'm going to have the patient lie down at a 30-degree angle, and I'll begin to assess for jugular vein distension. No heaves, look straight for me. No heaves or lifts noted on either side. So now we will repeat our auscultation of the heart sounds while the patient is supine, beginning on the right side, second intercostal space for aortic, pulmonic, herbs, tricuspid, mitral. We will also palpate each of these areas, feeling for any thrills, none noted on palpation. Now to continue, we will auscultate for the aorta, listening for any bruits. No bruits noted on the aorta. No bruits noted on the renal arteries as well. Now for the iliac arteries. And our femoral arteries. No bruits heard on auscultation. Now we're going to assess our carotid pulse, one at a time. 3+ and equal bilaterally. We'll auscultate with the bell for any bruits, and none are heard on auscultation. Now we will listen to our abdominal quadrants, assessing abdominal sounds. Abdominal sounds are normal active throughout. Now we'll percuss our abdominal fields, looking for any consolidation or hardness. It's tympanic throughout. Now we're going to palpate the abdominal area for any tenderness, masses, or any abnormalities. And none noted on abdominal assessment. Sorry. Now we're going to have the patient sit up. And you can come on back to the chair, and we'll begin our musculoskeletal assessment. I'm going to begin by palpating the joints of the fingers, the wrists, the elbows, and the shoulders, feeling for any swelling, redness, tenderness, crepitus, or nodules, none noted on exam. So now I'll begin with our fingers. I'm going to check our radial pulse real quick. 3+ equal bilaterally. Cap refill, less than 30 seconds. So now for range of motion, I want you to just mirror me. We're going to flex, extend, hyperextend, abduct, and adduct. Now for thumb opposition. Great. Now we're going to do our wrists. I want you to flex, extend, hyperextend. Now we'll do ulnar deviation and radial deviation. Great. Now for our biceps, I want you to pull up, or our elbows, pull up. Great. And pull down. Great. Actually, that was for strength. 5+ equal for the for the biceps. For range of motion of the elbows, I want you to flex, extend, and hyperextend. Now for the shoulders, I want you to flex. Yes. Extend. Hyperextend. Great. Now abduct and adduct. Now for cranial nerve number 11, the spinal accessory nerve, I'm going to assess strength of the shoulders. I want you to lift up. 5 out of 5 strength, equal bilaterally. Now we'll start with the hands. I want you to squeeze my fingers. Equal strength, 5 out of 5. We checked our bicep and our tricep already by accident. So now we're going to do some cranial motor tests. I want you to follow my instructions, and we're going to do finger opposition. I want you to take your thumb and go to each finger, and then repeat backwards. Great. Now we're going to do the finger-to-finger test. Take your finger on one hand and touch mine. Great. Both hands. Great. Now, what we're going to do is called the hand flip-flop. I want you to just take your hands and... Great. Now we're going to move on to range of motion and strength and the lower extremities. We'll start out by checking pulses of our dorsalis pedis, our posterior tibial. 3 plus equal pulses bilaterally. Check cap refill less than 30 seconds. We'll check range of motion and strength in just this leg for this patient because she recently hurt this ankle. So we'll do dorsal flexion, plantar flexion, then we'll do internal rotation, external rotation. Great. Now strength, push down, 5 out of 5, pull up, 5 out of 5. Now we're going to move on to the knees. I want you to push up on me. Great. Now flex back. Great. Now for abduction of the hips, I want you to push out. Great. Now I want you to pull in. 5 out of 5 strength bilaterally throughout, except for this poor ankle that doesn't work well right now. Now I'm going to have you stand up. Now for hip flexion, I want you to take each leg and go up. You can use the chair if you need it. Now I want you to extend, take one leg and go back. Great. Now the other. Now hyperextend. Go a little further back if you can. Great job. Now we're going to do abduction. I want you to go out one each. Great. Adduction is you here together. Now for internal rotation, I want you to take a leg and swing it over. Great. Now the other. Now I want you to swing it back for external rotation. Great. Now for the knees, I want you to hold one knee up, pull it back for flex, extend, hyperextend if you can. Great. Now do the other leg if you can. Great. Movement equal bilaterally for our knees as well. Now we're going to do the Romberg test. I want you to keep your eyes closed, hold your hands straight out, keep your feet together. Hands straight out, yes, and just stand still. I'm going to assess for any swaying. Patient is not swaying, Romberg test negative. Now we're going to assess gait. I want you to just take 4 normal steps forward and then turn around and walk back. Great job. Now do the same thing, but I want you to do heel-toe walking, and we'll test your tandem gait. Great. Now if you want to have a seat, I'll finish your exam. We're going to test your reflexes. We'll check your brachial radial reflex. Perfect. Perfect. Your bicep and tricep. And then your patellar, your Achilles, perfect. And finally, Babinski. Babinski negative. Well, that concludes your exam today, Miss Blair. Thank you for letting me take care of you.